أهلا بيكم. Today we're going to study the carotid triangle. We're going slightly higher till we reach the mandible, and then we study the pharynx and larynx, and we'll be done with the neck. The carotid triangle, it's a very important triangle. It has lots of things there. Major events like the bifurcation of the common carotid artery, for example. And notice the boundary of the triangle. The superior boundary is posterior billy of digastric. Anterior boundary is the superior billy of omohyoid. And the posterior border or boundary is the middle of the anterior border of the sternomastoid. It extends up as with the inferior billy of digastric. This lecture will include many names and branches, so we can't help it. But my role is to simplify the way all the structures we're going to talk about, the way they are arranged here. And this is the major topic, the major target in this lecture. The contents of the carotid triangle is as we said, the common carotid artery dividing into external and internal carotids. The branches of the external carotid, except the occipital, will be there in the carotid triangle. The corresponding tributaries to the internal jugular vein will be there. Nerves like 10 and 11 and 12, vagus, accessory, and hypoglossal nerves. Roots of ansa cervicalis and transverse cervical nerves. Remember the transverse cervical nerve that came out the posterior border of the sternomastoid and turned anteriorly to supply the skin of the anterior triangle. It's a branch of the cervical plexus. We studied this. So let's start. The common carotid artery. It, on the right side, arises from the brachiocephalic trunk. We have only one brachiocephalic trunk. On the left side, it arises from lower down in the arch of the aorta. They both ascend at the side of the neck, wrapped in sheath, carotid sheath, together with the internal jugular vein and the vagus nerve in between and posterior. All this we know about. The level of bifurcation at the upper border of the thyroid cartilage, it bifurcates there. And at the level of bifurcation, in the wall of the common carotid and the internal carotid branch, there is a swelling, a bulb of the carotid artery. In the wall of this swelling, there is a receptor, baroreceptor, called the carotid sinus. It measures the changes in blood pressure, especially the one that's going inside the skull through the internal carotid artery, i.e. to the brain. It's called the carotid sinus. And by the way, its afferents is taken up by the branch from the glossopharyngeal nerve, and some books add the vagus nerve as well. Another collection of receptors near the origin of the internal carotid artery. It's called the carotid body. And this is not a baroreceptor, it's a chemoreceptor. It detects the changes in oxygen levels, and in some books you will see that they stated it measures mainly the CO2 levels, because the CO2 is the toxin here. I will go with the opinion that it's most sensitive to changes in CO2 and O2 as well. So these are about the carotid sinus and carotid body. It gives off the external and internal carotid. The internal carotid artery has nothing to do with the neck. Actually, it has no branches in neck, ascends at the side of the internal jugular vein, wrapped with it in the carotid sheath with the lower four cranial nerves, and as it reaches the base of the skull, the underneath the petrous bone, it enters what's so-called the carotid canal in the petrous part of the temporal bone, and it finds its way up inside the cavity of the skull to begin to supply the eye and the brain. We will study this in details, of course. So it has no branches in the neck. Otherwise, it has some important relations when it comes to the carotid sheath, when it comes to structures passing between internal carotid and external carotid. All these are very good multiple choice questions to ask. See here, this is this beautiful specimen. This is the left common carotid artery, and this is the bifurcation, and as you can see, the bifurcation is rather dilated together with the one that continues as the internal carotid, the carotid sinus, as you can see here. Lateral to it and posterior is the vagus nerve and the internal jugular vein. Okay? It's very easy. Now comes actually the boring part. The boring because we have lots of names and branches to learn by heart. And that I consider boring. But anyway, no way we can escape this. It's very important. Now the external carotid artery immediately gives branches. The sets of branches, you will find different classifications in books, but the facts are that there are anterior branches like the superior thyroid, lingual, and facial arteries. There are medial branches like the ascending pharyngeal artery, and there are posterior branches like the occipital artery and the posterior auricular artery, and terminal branches like the maxillary artery and the superficial temporal arteries. This is how the external carotid artery gives its branches, and it's in sequence. By the way, when I say superior thyroid, then lingual, then facial, this is what's happening, and you should learn them the way they are organized, by the levels of their origins, like the superior thyroid and the lingual and the facial. You should know that the facial is above the lingual and so forth. Okay, so this a briefing about the external carotid. Let's study the branches. First branch is the superior thyroid artery, and as we studied in the last lecture with the blood supply of the thyroid, you saw how it goes down, and near the apex of the lateral lobe of the thyroid, it divides into two major branches, and it's accompanied by the external laryngeal nerve, and we talked about that. The superior thyroid. Don't forget that it supplies the larynx too, because it gives the superior laryngeal artery. So expect to find an inferior laryngeal artery. Okay? Okay. Next one is the lingual artery. Lingual artery arises and makes a small loop before disappearing medial or deep to the hyoglossus muscle. See that? This is the lingual artery, disappeared medial to the hyoglossus muscle to supply the tongue, and you can see some of the terminal branches of the lingual artery. Why does it make a loop? It's a slack during swallowing. During swallowing, the larynx goes up, so it will take the lingual artery with it. If it was, tight, it will get torn. So that's why it has a loop. The same idea of the inferior thyroid, because the mass that consists of the larynx and the thyroid on top moves upwards as one unit, so not to get torn during swallowing. This is the lingual artery. Remember the relation that it passes deep to hypoglossus muscle. Okay. Uh, um, because the lingual nerve is superficial to hypoglossus muscle. See, that's why I want you to concentrate here. The facial artery. The facial artery is deep to stylohyoid and posterior belly of digastric. It has a zigzag course. It goes upwards toward the submandibular gland and actually related to its posterior surface, then superior surface. Now it's hidden by the mandible. To come out of the mandible, it must descend lateral to the submandibular and curves up on the mandible anterior to the masseter. So part of it is hidden under the mandible. Don't forget that. To supply, to be close to the pharynx and ascend the ascending palatine and tonsillar branches there, and also to supply the gland, the submandibular gland. And as we know now, it does not only supply blood, but it supplies exactly electricity with it, the plexus around it, sympathetic supply. Excellent. Now this is the lingual and the facial. Ascending pharyngeal, it's not apparent here, but it comes from the medial side, opposite the origin of the superior thyroid, and ascends on the pharynx to supply it. Okay? That's easy as you can get. The occipital artery. Remember that the occipital artery, this is this one, from the posterior surface of the artery, that's one thing. It's hidden underneath the posterior belly of digastric, or in some books you can they might say that it's parallel to the inferior border of digastric. Anyways, it's related to the posterior belly of digastric, deep and inferiorly. So don't forget that, because there is another artery from the posterior aspect of the external carotid, which is the posterior auricular, this one. See, it goes behind the auricle, supply the area. It's parallel to the upper border of the posterior belly of digastric. So the digastric muscle has two arteries related to it. The occipital hidden by it and inferior, while the posterior auricular above its border, superior border, parallel to it and going to the area behind and the ear auricle. Okay? The two terminal branches, the superficial temporal, as it ascends in front of the ear, and it crosses till there's a zygomatic process of the temporal bone, going upwards and actually divides eventually into anterior and posterior branches, and this division is opposite a very important area in the skull called the pterion. We will study it later. The maxillary, and let's stop here for a while about the naming. Now, if you're reading from British books, almost all anatomy books, this is called the maxillary artery, and the facial artery is called the facial artery. But in American books, you will find that the maxillary artery is named internal maxillary, and the facial is named superficial or outer external maxillary. You get it? So if you insist on naming this internal maxillary, don't say facial, say external maxillary. But we will go by the maxillary and facial, which you will find in most books. It goes anterior on its way to the pterygopalatine fossa, giving around 15 branches. We will study them later when we get to the infratemporal fossa. Okay? So this is the story of the external carotid artery. Now remember that it arose from the common carotid medial to internal carotid. On its way up, it becomes anterior to the internal carotid, then becomes lateral to the internal carotid. See? Anterior, then lateral, means it curves rather backwards. So there are structures that pass between the internal and external carotid arteries. And remember the relation down there, right at the bifurcation, that the internal carotid actually lateral and external carotid is medial. Remember that external carotid has to supply the neck and face, so it must stay close to these structures as much as possible. Get it? Tamam. Okay. Let's proceed. Structures between external carotid and internal carotid. We will understand them more when we study the styloid apparatus, but for now, learn that it's the stylopharyngeus muscle with the glossopharyngeal nerve crossing underneath its lower border, curving underneath its lower border in between the two arteries, the pharyngeal branch of vagus, and it's beneath the glossopharyngeal nerve, the styloglossus muscle, and the tip or the end of the styloid process may be there or not. But these are the structures between the internal carotid and external carotid. Means that the internal carotid is the deepest here. Then as you go lateral or superficial, you will encounter these structures. Then the external carotid artery, which is deep to stylohyoid and digastric. You got the idea? Okay. Now the internal jugular vein. Internal jugular vein, it starts as a continuation of a dural venous sinus. Of course, we will study dural venous sinuses. One called the sigmoid, it's a big sinus. It continues out of the jugular foramen as the internal jugular vein by forming a dilation first, like a cup-like dilation. It's called the bulb of the internal jugular vein. Now this bulb receives another dural venous sinus, which is the inferior petrosal sinus, and it opens into the internal jugular vein as the first tributary. It descends down, it takes tributaries, remember this, that corresponds to the anterior branches of the external carotid, like it takes a superior thyroid, it takes, remember the middle thyroid, takes lingual, takes facial, okay? And occipital, plus occipital, it takes also occipital, and it takes directly from the pharynx, pharyngeal tributaries as it goes down. Okay, don't please forget that. And of course, we have to repeat that it was enclosed in the carotid sheath upwards with the internal carotid artery with the vagus between and posterior, and lower down between it's wrapped with the common carotid and also the vagus, the same relation between and posterior. Okay, now don't forget also that on the anterior wall of the carotid sheath, and especially on the internal jugular vein, is the ansa cervicalis. Do not forget that. Excellent. Now the nerves involved in this carotid triangle area are 9, 10, 11, and 12. The glossopharyngeal, the vagus, the accessory, and hypoglossal. And the spinal nerves involved are the transverse cervical branch that supplies the skin of the anterior triangle, and the ansa cervicalis. Okay, now regarding the glossopharyngeal nerve, it exits through the jugular foramen and descends between the internal carotid and the internal jugular vein, curves anteriorly and passes between the external carotid and internal carotid while curving under the stylopharyngeus and curving from lateral to medial below it, and it goes between the superior and middle constrictors and of the pharynx, and on its way to the palatine area and the back of tongue to supply the pharynx there. it shares in a very important plexus called the pharyngeal plexus. We will study this later with the pharynx. But remember the relationship with the stylopharyngeus is curves around the inferior border, and remember that it goes to the oropharynx to supply mainly there. Now this is the glossopharyngeal nerve. See that? This is the glossopharyngeal nerve. And this is the hypoglossal nerve. This is the external carotid artery, and this is the lingual artery coming out. Now, to be oriented, we are looking from the left side. We removed the mylohyoid. We removed the hyoglossus. It's reflected. You see that? So we are deep to hyoglossus. What will you find deep to hyoglossus is the lingual artery. See, the hypoglossal is superficial to hyoglossus. So that's why it disappeared here, because the hyoglossus is reflected towards you. This is the lingual artery, and this is the glossopharyngeal nerve. Okay, this is a beautiful specimen. Another specimen to show the vagus nerve. This is the vagus nerve. Okay, and remember in the posterior triangle you saw the accessory nerve. Now the vagus nerve exits through jugular foramen as well, descends between the internal carotid and the internal jugular. We know the relation in the carotid sheath as it enters the thorax down, but in the neck it gives off pharyngeal branch. It picks from the carotid sinus and carotid body maybe, and maybe may descend a descending cardiac branch. And of course the most important branch is the pharyngeal branch of vagus. This is part of the pharyngeal plexus to supply. Actually, it's the motor component to the pharynx. Accessory nerve. We talked about the story of the accessory nerve, that actually it's a misnomer. The one that comes out is the spinal accessory, not the cranial accessory. But they insist on naming it a cranial accessory because some exchange of fibers. But I told you that in some cadavers I found the spinal accessory coming directly out of the vertebral column without intracranial course and supplying the sternomastoid and trapezius, the same thing. Remember, it's part of the carotid sheath, and as it enters from the jugular, as it go down from the jugular foramen, it turns backwards on the internal jugular vein to supply, of course, the sternomastoid, then goes to the posterior triangle to supply the trapezius. This is a very simple drawing to arrange structures in this area. How to arrange it? Look, the deepest structure is the superior laryngeal nerve branch of vagus that we forgot to say. It has a superior laryngeal branch that divides into external and internal laryngeal nerves. Internal laryngeal nerve, this one, it goes to supply the larynx. External laryngeal nerve will supply the cricothyroid muscle, also muscle of the larynx. So it's important. It's the deepest structure in the carotid triangle. Now, what's the most superficial structure? It's not drawn here, but it's the hypoglossal nerve, because the hypoglossal nerve descends, crosses the internal carotid, crosses the external carotid, and then crosses the loop of the lingual artery, crosses these three arteries, and then go on the lateral side of the hyoglossus muscle. So do not forget this. It descends on the internal carotid, yes, but at the end, lower down, it will cross internal, then external, then the lingual branch, while giving off the fibers it carried from C1, not its own fibers, as the superior root of the ansa cervicalis. So the most superficial is the hypoglossal nerve. The deepest is the superior laryngeal nerve. And in between, the two arteries, external and internal carotid arteries, with structures in between. Now you have arranged the structures in the carotid triangle, so don't worry about it. know that the deepest structure is the superior laryngeal. The most superficial structure is the hypoglossal nerve, so it's like a sandwich. And the structures in between are two arteries with structures in between, like the glossopharyngeal nerve, stylopharyngeus, pharyngeal branch of vagus. And lateral to this, you put the internal jugular vein. And that's it. This is the arrangement in the carotid triangle, and don't worry about it. If you understood this, I consider this a success, because you have to know how they are packed in this tiny space, which is the carotid triangle. Okay? By the way, the carotid triangle is visible as a notch in front of the neck, and you can extend the neck of the patient and ask him to look right or left to expose the corresponding carotid triangle area. You might feel the pulsations there. Of course, you will feel the pulsations of the common carotid there, and you might see the pulsations of the internal jugular vein. This is called the JVP, the jugular venous pulse. It's a very characteristic pulse with two peaks, A and V waves. You will study this in physiology. The jugular venous pulse. Now the hypoglossal nerve, see that this is a more superficial level. This is the hyoglossus in place. Now we are on the lateral surface of hyoglossus. See the artery deep to hyoglossus. It's not showing here, the lingual artery. What else is showing? The lingual nerve. See that? Okay, lingual nerve. You see these filaments coming out of the nerve to form the submandibular ganglia. And below that is the hypoglossal nerve. See, it's a very beautiful specimen, this one. The nerves are dissected the way they are shown. Lingual nerve. How did I know? This is the hyoglossus. We are lateral to hyoglossus. We are superficial to hyoglossus. Okay? And of course the mylohyoid being removed. The hypoglossal nerve exits through the jugular venous, jugular foramen, descends on the internal carotid artery, and then it crosses the three arteries, remember? The internal, the external, and the loop of the lingual, see? Crossing the lingual. And then it goes lateral to the hyoglossus, then it disappears under the mylohyoid muscle to supply the muscles of the tongue. It does not give branches outside the tongue. No, but it may look like it gave some branches. These are the C1 branches. It picked up, once it descended from the skull, it picked up from C1 to distribute. Remember the three destinations? The superior root of ansa cervicalis, nerve to thyrohyoid, and nerve to geniohyoid. Exactly. Now this is another beautiful specimen. This is the right side. See, this is the internal jugular vein. This is the spinal accessory, the cranial accessory actually going backwards. This is the hypoglossal nerve coming out of the hypoglossal canal going down. See that? This is the vagus nerve. Sooner or later, the hypoglossal will descend on the internal carotid artery and cross forward anteriorly. This is the internal carotid artery. This is the vagus. This is the hypoglossal nerve, and this is the jugular foramen. This is the facial nerve as it comes out from the stylomastoid foramen. See that? This is the facial nerve. See that? Coming out of the stylomastoid foramen, nerve number 7. Okay, the transverse cervical nerve, we talked about it. It's coming from the cervical plexus, curves anterior on the sternomastoid and divides many branches to cover the area of the anterior triangle. The ansa cervicalis as well, we talked about it. The superior root from the hypoglossal and inferior root from C2 and 3. The superior root being from C1, and remember we mentioned that the superior root supplies superior belly of omohyoid, and then joins C2 and 3 and supply the rest of the infrahyoid muscles. Remember that. Okay, this is an illustration to show you the ANSA. See how it's formed. C1, it traveled with hypoglossal, descended as superior root, while descending supplied the superior belly of omohyoid, and then joined C2 and 3. Remember the C2 and 3, they either come lateral or medial to the internal jugular vein. They joined the superior root and supplied the rest of the muscles of the strap muscles, the infrahyoid muscles. Now see here the internal jugular vein with the ANSA on top of it. Okay? Okay. Thank you for watching.